would like to welcome our panelists and welcome everyone who is joining us on this Wednesday evening. I'm actually welcoming you on behalf of the Education Committee. This is our May In Focus. In the Education Committee, we have chosen to do the In Focus because we wanted a way to really engage our faith, the faith of the folks at Royal Lane, with things that were happening in Dallas and things that felt in the moment and very relevant. And so, as you can imagine, when we were brainstorming ideas for May, we had a schedule set up, and the COVID-19 and stay in place orders had really changed everything. So when we were talking, we thought, we've done so much to physically take care of ourselves. People are staying at home, are not going out. We've changed really the order of our very lives. And yet we haven't talked as much about how to take care of our spirit and how to take care of the other people in our lives, and what COVID and the changes of COVID have really done to each of us in how we feel and think and in what we're doing for ourselves and for others. So thank you for coming to our In Focus. We are very lucky to have a panel of professional chaplains, all of who are members of our church. So I will introduce them. And then if you are on the live stream, anytime this evening that you have a question or would like to offer something for one of them to address, please put it in the chat. And then I think Tim will relay it to Mike. Mike will probably relay it to us or relay it to me. We will also have this recorded and we'll be able to show it again. So if you hear something from one of the panelists that you would like to hear again or refer to later, please come back to the website and watch it again. It will absolutely be there. I'm hoping also that we'll have our deacons and others in the church who care for the people of the church be able to watch, because I think we're going to hear some good information tonight. I'm going to start in alphabetical order, so you don't wonder why I'm introducing who first, but we're going to start with Blake Miller. After graduating from Wake Forest University School of Divinity, Blake started his ministerial career serving in youth ministry in Texas. Many of you may remember his time at Royal Lane with our youth. However, in 2018, Blake commenced a new ministerial challenge and took on the role of corporate chaplain for First Rate Incorporated. And that's where he is now in Arlington. He currently provides spiritual care for all of the employees and their families. So he'll be talking to us tonight from the perspective of someone who does corporate chaplaincy. We have on our panel tonight also Melissa Walker-Luckett, who is a professional certified chaplain. She's certified by the ACPE, which is the Association of Clinical Pastoral Education, which is the standard for spiritual care and education. She's certified as an educator, but she's currently serving as the manager of clinical pastoral education at Children's Medical Center in Dallas and does chaplaincy there, as she also works with training the students and training the educators. She is the current national chair of the board for the Association of Clinical Pastoral Education. She has been a member of Royal Lane since the 1980s. Royal Lane is where she was ordained, and as you all know, she has served in many leadership capacities at our church. We also welcome tonight Rianne Timon, who is a chaplain at the Children's Medical Center, Dallas. She's a certified educator candidate with ACPE, which, as I said, is the standard for spiritual care and education. Rianne was ordained here at Royal Lane in 2019, and she is endorsed through the Alliance of the Baptists. I asked our panelists if they wanted to start the conversation just by sharing something that they've been encountering in their chaplaincy since the COVID-19 has started. I thought they're giving a brief introduction to things that they have been talking about or things that have been coming across their radar or their awareness. That might help us jump in with some of our questions. So I think if Blake is ready to do a brief opening, as his name starts with B, we'll just jump to Blake. Welcome, Blake. Thank you so much for sharing your time with us.
Thank you for having me. It's an honor to be amongst this esteemed panel. As sometimes corporate chaplains can be considered chaplains light, it's nice to be on the same level as as Rianne and Melissa. But it's been quite a change in corporate chaplaincy for me during this time, because unlike at a hospital chaplain where you have new patients coming in all the time and having to foster new connections and provide care, spiritual care and counseling for new families, I get to work along the same 100-ish people every day, and I see them 9 to 5, Monday through Wednesday. And so having that personal connection that so many of you tuning in have with your coworkers, and not being able to get that social aspect has been such a drag for all of our employees. Everyone is pining to get back to the way it was before so that they can interact in the cafeteria the same way, that they can hop in a car and go get some yogurt together. And, they're pining for a time, just to come into my office like they used to, and we can lay our hands on those that are in need of prayer. And, you know, we're a long way from that. And we need to be cautious. And it's been a challenge on my part, because I try to counsel them to take the caution and not rush back into those practices that we had before. But that removal from that social connection at the office place has just been a common theme. And even when you can pretend and joke that your coworker, spilled their milk, like so many people like to joke about their toddlers or children as coworkers during this time, jokes can only last so long. And you have to find other coping mechanisms. And so that's where it's been a challenge for me to help step in and help provide pass and care for them to foster new coping as they deal with this loss of connection.
Well, and I think many of the folks at Royal Lane are missing the people they work with also, and missing the people they go to church with. So I think we'll continue to talk about this as our conversation goes on. To not be able to connect in your community for good humor and for something as casual as lunch or yogurt is difficult. And I also, hearing what you're saying, there's so much uncertainty. I know when we started, we thought our date was April 30th, and then it's moved back to May 15th. And as we know, the governor has done some opening, but if you read what the City Council of Dallas put out yesterday, it looks like we have a long road to go. So hopefully tonight we can hear from our chaplains and just think of ways to help people just address the unknown and the uncertainty of when do things go back to what we call normal. Rhiannon, are you ready to do your sharing? I'm jumping out of order for alphabet, but I see your face next on my gallery. So we'd love to hear from you.
Yes, hello everyone. Thank you so much for the opportunity to join you tonight. I agree with Blake and how so much has changed, and even the little moments that we used to enjoy with one another are now so different. In the hospital setting, one of the things that I see over and over again is the isolation and loneliness that comes with being in a space where you used to gather with all of your loved ones and your church community and your support, and now you can't. And that is a huge, huge grief for all who are involved. Me personally, it's the first time since being a chaplain that I have been alongside everyone else doing the same thing. We're all in the same place of this isolation, doing new tasks, doing something different. And so not only am I hearing the stories of how others are experiencing it, but I'm also experiencing it too. And also experiencing the challenge of trying to work a full-time job and be a full-time mother and full-time educator for my children. It feels like a lot. And if I didn't have these spiritual resources to lean back on and things to connect me and ground me, I would have a lot harder time going through the day to day. So I'm really grateful to get to have an opportunity to talk with and engage about this tonight.
Thank you so much. I think to think of you as a professional chaplain caring for children in the hospital who are sick and their families and the staff who take care of them, and also your own daughters at home, it does sound like a lot. And I think again, at church, a lot of folks are facing that. The responsibility has kind of layered itself on top of, one layer after the other. So I hope we can talk about that. And it may not be too much to say some of our folks at Royal Lane are feeling overwhelmed. I know I don't work full time, and yet doing education and taking care of other responsibilities still feels overwhelming as the world has changed. I think we can move to Melissa. Melissa, do you want to share opening information, and then we'll go into some of the questions?
Sure. So thank you for asking me to participate in this. Sorry for my phone. The thing that I am really aware of on a personal level is that my work, the way I work, has changed significantly. We're to try to keep from having everybody get sick at the same time, or someone spread it to someone else. We are working in 2 teams. So I have 2 students that I have not seen, 2 chaplains that I have not seen in person in however long we've been in this lockdown. It feels like forever to me. I've talked with them, I've been in communication with them, and I just have not been in the same room with them. And one of them is a member of Royal Lane. And so that's hard. And it also means that I don't have my regular schedule. I work from home Monday and Tuesday and have Zoom all day on Wednesday for class. And then I go to work Thursday, Friday, and sometimes Saturday. So there's this constant sense of disorientation for me personally anyway. Things that I think on Friday or Saturday that I want to make sure I have for Monday and Tuesday and Wednesday, invariably it's not in my bag when I get home. And, so it's just this sort of disorientation almost all the time. And I'm really not very good with that. The first couple of weeks, I personally had anxiety about mid-morning on Monday. I would feel my chest get tight, and I would think, oh my gosh, I can't get this done. And so then I'd have to go do some deep breathing and remember that, well, no, I might not can do that one thing, but there are these other things that I can do. So I will tell you that in this, what I see in what I've worked with staff recently is this really significant grief over some of the restrictions that have been put on families because of the COVID restrictions and trying to keep the children and the staff safe. No child, except at the time of death, has more than 1 visitor in their room at any given time from their family. And that's hard on the children. It's hard on their parents who both want to be there, or their grandparents who want to relieve the parents and be with their grandchild when they're sick. It's also difficult on the staff because they have to be the rule keeper at a time when they don't want to be the rule keeper, and they don't want to put those restrictions on patients and families. So I think there's a lot of tightness and a lot of tension amongst most of us in the hospital and outside. So that's what I'm seeing right now.
I love the use of the word disorientation. I hadn't thought of it like that, but it's immediately I resonated with that. It's that sense that things are just never quite what they seem to be, and things, the things that you're used to doing, you can't do. As many of you know, we're filming Church Not on Sundays. So to prepare and have church ourselves on Sundays and then not actually have church for several more days has felt incredibly disorienting when I do the children's sermon. I always am kind of playing catch up with myself. Listening to what the 3 of you said actually brings me to my first question. It is such a relief to hear you say things aren't fine. I hear Blake saying, his employees are hoping or pining for something else, and Rianne talking about just the sense of being overwhelmed, and Melissa talking about disorientation. I think at Royal Lane, many of us are worried about our family or our friends. And so when people ask us how we are, our immediate response is fine, things are okay, because we don't want to bring someone else down, or we don't want to make them feel responsible for how we're feeling. I know also we have deacons taking care of ministry groups, and they'll call someone who will say, oh, I'm fine, I'm okay. And then We know, though, for a fact that folks in our congregation are facing job changes, are facing health issues, are facing deaths in the family and other things. So I wanted to know from you as chaplains, is it okay to not say things are fine? Are there cues that other people give us that would allow us to know this is someone I can really be authentic with? And from the other perspective, if we want to help take care of our church members who are our friends and our family, are there ways to let them know they don't have to tell us they're just fine? They can tell us really how they're feeling. They can share their joys or their concerns with us, and we're here to listen. I imagine sometimes people want to tell chaplains, oh, it's fine. And because of your professional capacities, you help open and engage conversation. So maybe you could just tell us a little bit about the value of that conversation and how we might invite that conversation from folks in our lives who need that conversation. I'm going to let whoever talks first be the next speaker, and Mike will just set them on spotlight so we'll know who we're listening to.
Okay, I certainly have a response to that. Thank you, Laura, for that question. I think I too tend to still say I'm fine the moment that someone asks me how I am. It's almost like it's a habit. That's the very next thing that's going to come out of my mouth. And I think it's partly just a conversational piece that we always have in that exchange. How are you? I'm fine. But for me personally, I'll share from my personal experience first, is one of the things that I've recognized that I'm doing in gauging my fineness is by comparing it to others. Well, I'm in a pediatric hospital, and this experience isn't as rough on pediatric patients as it is in the adult hospitals. I can't imagine what they're going through. And then people come and say to me, well, I can't imagine teaching my kids and being at work at the same time. So you're having a harder time than me. And it's a trend that, from what I'm experiencing, is we compare ourselves to states that are having a harder time, people that are having a harder time, emotions of someone that we can put up together as their experience is rougher than ours. And so that, therefore, I'm fine. But what that does is it invalidates what your experience actually is. And it invalidates your opportunity to express and well, just express it. I know for sure the experience that I've had in working as a chaplain, many times when I talk with families, they will say, wow, now I feel better just getting that off my chest, just saying it out loud. And so validating your own experience in this doesn't invalidate someone else's that may or may not be harder than yours. It gives you the opportunity to share and share fully what you have. And that experience alone can actually relieve some of your stress and anxiety that you might be feeling.
To your question, Laura, about how to encourage people to say more, you've been saying actually lots of things that would invite people to say more. I think what I would tell people is to trust your relationship with the person that you're asking, how are you doing? And in trusting that relationship, be gently persistent, just to say, well, would you like to say more about how you're being fine? Or really? You sure you're fine? Because most people aren't right now, but to gently just say, I'm really here to listen, and it's okay if you're not fine. I'm really willing to hear you out, because it's important to me that somebody hears me out too, and put ourselves in we move alongside people when we own that, and we touch them just a little more. We ask just gently one more question, or maybe two, to let them believe that you really do care. Because if I say fine and you go, okay, well, blah, 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 then that gives me a negative reinforcement that, yeah, you really just want to hear that I'm fine. But if I really want to know how you're doing, I will stop and ask again. So I think I would say for people to be courageous about that, gently courageous about asking again.
And I would like to just piggyback off of that and say that the power of empathy and honesty is what gets you across that barrier. For me, a lot of times when I get that reaction of I'm just fine, I'll follow it up with the honesty that most of the time, the day before or a couple days before, it stunk for me. It was wonky. It didn't feel right. There was something off. And when I open up and am honest about the struggle I had, that forms that connection, and they're more willing to offer up a little raw take beyond the I'm fine, and that they're able to recognize that even if it's not that day, because some days are actually great. Some days you're able to work from home on your couch and the sun shines bright through the windows and you just feel God's presence through your work. Other days it's the exact opposite. And whichever day you're at, looking back at the struggles you had help you through that conversation, help form that connection, and can help you start to look inward to help find the strength you're going to need as this continues.
I really appreciate those responses. I love the idea of being kind of courageously, gently persistent. And also what Blake is saying to me is so true. There are such highs and lows that maybe when someone does ask you feel fine. I was talking to one of the parents at Royal Lane, and you feel fine, and then you read an email that usually wouldn't cause any emotion. And I find myself, or this person finds themselves crying during the reading of an email about collecting books at school. And you think, okay, I am a little more, Blake, you used the word raw. I am a little more raw because normally I would not be crying at this email. Speaking though of being fine, I think I just had an introvert wave his hand into the screen. That was my introvert Brody, but we have a question from Gary Wisdom that I'd like to just kind of put out there for our chaplains. It says, should I feel guilty that I don't mind being quarantined and am in no hurry to interact physically with others? What's wrong with me? I mean, I think for some of us who are more introverted, quarantine and social distancing isn't all bad. So what do you have to say to Gary's question?
I want to answer because I think, first of all, let me just say no, quite frankly, no, you shouldn't feel guilty. It's truly where you are. And I think we can honor that. It's not that you're being any less caring about anybody. This is a time to trust yourself and to trust what you feel is right for you. And in general, I'm against feeling guilty unless you've done something wrong. And I don't think wanting to stay home with your dog and a good book is wrong.
I like the answer. Let's get rid of any excess guilt. Well, and I think part of what we recognize at Royal Lane is we have folks coming from such different places in life. We have retired folks. We have folks who are starting new jobs, new marriages. We have, folks who have family in the neighborhood and folks who don't have family but many states away. And so I imagine each one of us is experiencing this in such a unique way. I love the answer, just really be you. Like I appreciate us not having to apologize for who we are. We don't have another question on the chat, so I have a question that I'm gonna present just hearing. I heard Rianne use the word grief and I heard Melissa use the word grief. I find in my everyday life, grief is not a word that we use very much unless we're talking about really large grief. The large grief of the loss of someone's life, or the large grief of a major divorce, or a major family happening. So I wonder if you can talk to us just about the small sense of grief that is ongoing, or the losses. I know we have 2 seniors at Royal Lane who are going to miss their graduations completely. One of our seniors' mother put on Facebook yesterday these beautiful pictures of him in his gown and his robe, posing outside of the high school, standing on the sign and kind of having fun with it. But it really struck me what a major loss to work all of those years and not get to graduate with your friends. We have, I think many of our students play sports and have lost whole entire seasons. I think of our adults and Mother's Day, how different Mother's Day was for many of our grandmothers, especially who were, apart from the families that would normally have come into town, would have taken them out. So I don't know if you can help us just think about loss and grief in smaller terms, not just as big losses, but what we're experiencing. And is there things that folks can do or ways that you would offer for us to be able to address that or name that for ourselves?
Yes, I'll begin to share because as I heard you talking about it, I thought even the losses that you're talking about still feel like really big losses at first. You know, missing a graduation ceremony, that is a huge grief, a huge loss to have worked so hard and to not get to experience that ritual. But there are little griefs. The Mother's Day one is, I think, one that can come and go and that you can miss. So many little griefs along the way, losses that we experience that because it's not a big surmountable thing that we would grieve, we don't always recognize it as grief. But our body and our mind still experience it as a loss. And the grief that I'm referring to when I reflect on that is all of the things that we have to not get to have in these moments that we want to have. I think about my kids who are grade school and are used to being able to do field trips, are used to being able to do end of school parties, connections to what that looks like to celebrate, finishing a grade and moving on to another grade. And they're not even near, high school level of graduation, but it's a really big deal to feel supported and encouraged and celebrated each and every step along the way. One of my children is struggling with the grief of just not having classmates to be connected to every day. She feels disconnected, and that's a hard thing for me to remember sometimes when I'm still at least getting the opportunity to go to work and to connect with a few of my colleagues that I love and care for. And they are here every day, missing out on all of those opportunities. And so when I think of the little losses of grief, that's what I think about. And again, as I was talking about expressing ourselves, noticing that and paying attention to that and not diminishing it as it didn't matter. I shouldn't feel that way. I shouldn't experience that. Honoring what you feel in that moment is really, really important.
We've become so conditioned to sweep the small things under the rug because there's such worse out there. And Rianne talked about this earlier, how we compare, well, it's not as bad here in Dallas as it is in New York. I still have my job when someone's lost theirs. This survivor's guilt almost to want to sweep your little griefs under the rug because they're not as big as what you see on the TV or read in the online so much. But the more you sweep under the rug, the bigger the clump gets, and it becomes unbearable at times. And the interesting thing about grief is when you actually confront it head on, it can provide you with a fuel that you normally wouldn't have. One of the examples I can think of is we have an employee that runs a summer camp, a day camp for underprivileged and homeless youth in the Arlington and Grand Prairie area. And of course, they had to cancel that day camp this year. And the grief of that loss is huge. And if she hadn't, if that person doesn't confront the grief of that, it can paralyze you and you move on to other things. But using the grief of that loss provided a fuel that inspired her and the rest of that team to then realize, okay, we have these funds, we can't do a camp. Let's just take meals as often as we can to the kids that would have been in our camp. And so they've created this whole new thing of how their nonprofit works to address the need. And that came from the fuel of grief. And if you sweep that under the rug, you can't tap into that source. And so no grief is too small.
I really appreciate that, Blake, the image of sweeping it under the rug. I was thinking about cumulative, the snowball gets bigger and bigger and bigger as it rolls down the hill. And the more grief that we have, the bigger it gets within us. And it's better if we do something with it and use it as fuel, as energy. Anger is another one of those things. Sometimes people express their grief really through anger, because for many of us, grief seems to weigh us down. It's heavy and weighs us down. Even little griefs, if you add enough of them, it gets heavy. You know, you put enough in a bag, it's going to get heavy. Anger, on the other hand, is a very active emotion that gives us a little momentum and fuel. And so some people, when they're acting very angry, are actually dealing with and acting out of their grief. And so I think we need to be aware of that phenomenon as well when we're dealing with folks who are having, the death at a million small losses, So yeah, thanks.
Can I ask a question, Laura?
Yes, please.
So for me, spiritual care and self-care go together. And so for me, I want to kind of think about what are the things we can do? Like, what is an action we can take? What's a discipline that we can do that can help us? What's one thing that each of our panelists would say that as we are experiencing grief, as we are feeling isolated, how can we care for self and care for spirit?
I want to say thank you for asking that question, because I've got an answer. We're quarantined, but we're not locked in our houses. And for those of us who have the ability to just be outside a little bit, this has been an amazingly beautiful and cool spring. The birds are singing. We have we have a wren that has 6 eggs, and we've been watching her. We've planted our garden, and we have a new ritual of just going outside every evening and being outside. We don't have to be in our workplaces. We don't have to be in our homes all the time. One of the people, I'm gonna call her out, Kathy Webb, talked about having a block party with people along her street, and everybody was sitting in their own yard, talking to each other across the street or across the way, doing social distancing. So I think there are ways to not be isolated, even if we're quarantined, and ways to take care of our spirits, whether it's with others or alone in the beauty of the outdoors.
Go ahead, Rianne.
Okay. Thank you, Melissa, for mentioning the word ritual. That's one of the things that I thought of too. I think I'm hesitant to say just one practice, because what I have realized in my time of trying to do self-care and spiritual care in work that can be dauntingly difficult, is that one person's recommendation to do a practice may not be the practice that works for me. And so my first and foremost piece of advice is to give grace to yourself on what that is that works for you, and recognize that not everything is going to work. And then when I think of a ritual, I think of I love the going outside every day ritual. For me, I make sure I am taking a ritual whenever I wash my hands every day. I can move so quickly through time that the moment to wash my hands is a moment to say a prayer. For me, I think breathing is also a really important ritual for me to help calm down and relax, and it's something that I use a lot with families in crisis in my chaplaincy work. Having a biblical mantra to say of a scripture or a prayer that really resonates with me can be really helpful in times of stress, and can be used as a brief, simple ritual any time of the day. Those are just a few things. I want to give Blake a chance to answer.
Well, I was going to say one of the things that worked well on the spiritual care aspect for our employees at First Rate was last week was the National Day of Prayer, and we had multiple times for prayer sessions that we did virtually. And the way it provided a connection that a lot of our employees had been missing with each other. And so it's, a lot of us with our small groups and Bible study classes, Sunday school classes, we'll organize with that. But there's nothing wrong with reaching out to just any of your friends, any of your loose acquaintances, and just saying, I need to pray. Let's Zoom this out and just see what happens, and let the connection fostered in that moment provide the care and comfort that both or all of you are going to need. And so that was a really good moment. And another spiritual care aspect is that I've been trying to help people at First Rate take on, but they've been reluctant to, is take time off. A lot of people that are still working from home, you still have PTO policies, you still have holidays. It's weird to think of taking a holiday to not go somewhere when everyone knows you can't go somewhere. But I encourage them, whatever little thing you can take off your plate for that day, if you can take it off and need to take it off, take it off. And if you have the time and breath in that moment, practice some centering prayer. It's crazy that, maybe add some isolation to your isolation to get you the recharge you need. Don't be afraid. I encourage them, don't be afraid. Now, it's easy for me, not their manager, to tell them, ask your manager for time off, but it's something that's needed. I see it in a lot of my conversations with my coworkers.
Seems like everything kind of melds together when we're like this, right? That we, I think it was Trevor Noah or somebody did this bit where he was working at home on his computer and he's like, oh, done for the day, closes his laptop, then scoots over on the couch, opens his laptop and say, now I'm home and I'm doing home stuff. And it's exactly in the same location, the same set of being and the way of being and set of setting around him. So for me, like, I think that's what's really weighing me down, is everything feels the same. Like I'm home and I'm doing a Zoom meeting at night or doing this or that. And it all feels like it's wrapped up together when I just need to shut it all down, go out and feed the ducks with my daughters or do something like that. And so I think, like Melissa was saying, some type of change of scenery of some sort. And like Blake said, a PTO, like have those schedules. Don't let work, because now that work is home with us, don't let that kind of consume what we are doing.
I completely agree with you. We've lost our time markers when we're working from home and at home, we're working at home and doing our work. It really is a difficult thing. That's one of the things that Jamie and I have started doing, is when we're both at home, we relax a minute and then we take our tea or whatever and we go out to the garden and we sit on the bench and the cats follow us. And we pull weeds for a while and we drink tea for a while and then we pull some more weeds or whatever. And then there's time has passed and we're actually at home. I'm not still at work. So that interval, that separation really is important. Great point, Mike. I really, really believe that. And I fell into that, just unknowingly, totally dumb luck.
I absolutely agree with that. We weren't very many weeks into this new pandemic and way of being when I realized that going to work felt like a break for me. And I thought, if going to a hospital in the middle of a pandemic feels like I'm getting a break, I'm not as okay as I think I am. So what it made me realize was that my natural way of being in the world is that I tend to think if I add one more thing or do one more thing or get this thing done, then I'll be able to relax and then I'll be able to settle down. But the truth of the matter is, even in regular life, that doesn't always work well. So now that things are even harder or more intense or added on top of in this space of quarantine life, adding more and more and more to my plate doesn't give me the rest that I need. It's what really gives me the self-care and help is that space, taking time to relax, taking time to rest. And I refer to that a lot as listening to my body, paying attention to what it is my body is feeling. If I'm feeling tight and tense and anxious, then I need to pay attention to that because I'm not caring for myself in the same way. If I'm tired, it's important to rest and get the rest that you need and give yourself the grace and permission to do that. I think it's a really important component to caring for yourself and nurturing your body spiritually.
Well, and I heard this as Blake was talking. I know for me, there's also this connection of identity to productivity. So if the things that I do and I love are canceled, there is this sense of, well, then in this moment, who am I? Who am I as the children's minister if we can't do the children's activities? Or, we've missed a lot of fun things at school, and I do an art program with the kids and we didn't get to do the awards, which is the most fun part when we get to celebrate everybody's work. And now I just drop them off on their front porch when they're not even looking out the door. So I think for me, part of the spiritual care has been a struggle of just self-identity. I'm so invested in productivity. So it's so nice to hear Blake say, PTO or Melissa, we have to separate. I love the idea of time markers. And I think it's a good lesson going forward, how much of who we are as a person of spirit is kind of diminished or is put aside to be a productive person, to be a person at work, to be a person that other people see as busy. And so some of what Mike did during the Lenten season has actually come back to me so much more strongly during the pandemic season. I listened during Lent and it was meaningful, but now I'm referring back, oh, this is what Mike Gregg was talking about during the Lenten sermon. Like, I don't have to be that busy because I still have a full spirit, even if I'm not going to be able to run VBS this summer and build a train, which I really wanted to do. So I appreciate your answers. I think one of the questions is kind of moving forward as we think of church community, are there ways that our church community can kind of take care of its corporate spirit or the spirit of Royal Lane? Are there ways that you as chaplains think we can do things that would just help us be connected in spirit and would help us respond to spirit? I loved Blake's idea of Zoom prayers. One of the Sunday school classes is meeting Saturday mornings, and it's not just for prayer, but they do a prayer list, and sometimes they send it out by email, so if you can't come. And I just love reading the names of the people that we can pray for and thinking about them. Like, that has been really meaningful to me. So I don't know if you have other ideas of how we as a church create opportunity for spirit and spiritual care and self-care of ourselves and really of our church self during this time.
One thing that I've done at First Rate is tap into the power of hope during this. We're inundated with bad news everywhere we look, and rightfully so, because there's so much of it. But there are little hopes and big hopes all around. One of the things that First Rate did for its employees early on in this shelter-in-place order was they approved $15 a day, workday, for each employee to use for lunch to support a local business. So, which is a great program, and it got everybody connected with the community. Well, I eventually thought, I don't need this extra $15 each workday to get lunch. I'll sacrifice one of my lunch. We'll see if any other first raters would want to sacrifice their lunch. And we created a lunch donation program through a local caterer. And I've gotten the privilege to research and connect with a lot of the local nonprofits that are in need and hear about the hope they're providing. And I help relay that hope on to the rest of the employees and give them an outlet to participate in that hope. And so every week we're able to get, over 75 box lunches to different nonprofits all across the Arlington DFW area. And it's providing an outlet to hear about hope, participate in hope, and, just dwell in the light of hope has been immensely powerful for First Rate. And I think that's some way that Royal Lane can tap into the hope and expose the rest of the Royal Lane community to little hopes out there, and say, we might participate this way. Being a part of that just makes all the difference at times like this.
I have been on social media more in the last 6 to 7 weeks than I think I have in the last 6 or 7 years. And one of the things that it has helped me do is connect with friends that I haven't talked to in literally a decade or more. I think it was the first Monday that I was working from home. I had text or messaged one of my friends from high school and said, hey, here's my cell phone number, call me, because I didn't want to ask her for hers. So she sent me back hers and she said, call me anytime because I'm not working. And that Monday I called her and we spent literally 2 hours on the phone, on the cell phone. And that gave me hope of continued connection from way back as well as new connections. This is so out of character for me, but I want to tell you about one thing to look up on the internet that may help you with your hope and give you some ideas. It's called SNG, Some Good News Network. And have y'all seen it? Y'all are reacting to it.
Oh yeah.
I love John, whatever his name is. I can't say it right, but I just love that because there's so many things that people are doing to bring hope. He did a virtual prom for all the seniors who were missing proms. And so, but there are other things out there as well, some a little more somber. What the other thing I would recommend to you is to Google Hindsight 2020. If you haven't seen that, I'd encourage you to look at it. It's a rather forward-looking piece that's just really nice, and it's nice. There was something, Laura, that you said about things to do, specific things. Well, I wrote a list. So can I give you a 2 or 3?
We would love to hear part of your list, all of your list. Give us all of your list.
So isolation, physical isolation. Call your friends even after years. Catching up can enrich your spirit and encourage you. You can encourage others. Fear and anxiety, just recognize that there really is something to be mindful and indeed anxious about, and to let that spur you into being mindful and prayerful about it. It is a deadly disease and many of us are susceptible to it. So there's, acknowledge it, center yourself with deep breathing or breath prayers, like Leanne said. Allow yourself to feel God's presence in that, and then make a ritual of giving the fear over to God somehow. Have something that you can move that over physically and lay it down. I don't know, whatever you want, a rock, I don't care, but have that ritual of giving that over so that you can see it there and walk away from it and not carry it in your pocket. Let's see. And read scripture and read poetry, because I believe poetry is some of God's inspiration put into people's minds. So I would recommend John O'Donohue or David White, Whyte. I've already said it, try to get outside if you can, not be careful if you're in urban areas. I think I've said most of others. Oh, if you have a pet, allow your spouse to spend as much time with that pet as you need to. One of the books I was reading recently said the cat had the ability to speak to the character, and the character was upset about something, and the cat walked up and said, "Pet the cat, you'll feel better." So the cat, the dog, the rabbit, allow yourself that. Eat well, sleep well, don't oversleep and don't undersleep, and write letters or cards. I love cards because I don't have to have a whole letter. I just have to have this much that I can write. And it means a lot to me to get it. And in that space, it causes me to be succinct and truthful about what I want to say to that person. So whether it's a piece of notebook paper or a card, I encourage you to do that. It'll be good. It's good for me. I hope it'll be good for you. And then, of course, on Fridays at noon, there's guided meditation with Mike Gregg. So
Thanks for the plug.
I know, beautiful plug.
Those are some of the things that I have been finding helpful. Back to your point of not being fine, acknowledge that you're not fine to yourself and to others and to God, and be as not fine as you need to be in that.
And for those of you in the community that the very first question that was asked about what if I'm not in a hurry for this to end? What if I am really fine and okay? I think our Royaling community so far has done a really fantastic job of taking those times and moments when one person is really fine and okay to reach out to someone else who they're not sure how they're doing. I've strangely felt even more so connected to our church community through this because of the ways that individual members are reaching out to one another. So I think we've done a really fabulous job at that. So keep it up, everyone, and keep reaching out to someone when you're feeling good. But I think one of the things we're trying to normalize here and say is it's okay to reach out and ask for someone when you need help too. It's okay to call someone and say, hey, I need some prayer. I think in times of crisis in my past, I was surprised when prayer didn't come as easily to me as I thought it might or could, but someone else's prayer had felt very meaningful to me. So being able to reach out and ask for that is a really beautiful way to connect with your faith community.
I want to say
go ahead.
On Sunday mornings, get your order of worship and sing out loud in your own house. That makes a big difference on Sunday morning. Sing those hymns with Harry and David and Weigel, and just sing them as loud as you can and with as much feeling as you can. And that will connect you to others. At least it does me. I will say that. I sing them out loud.
And don't shy away from channeling God through the physical connection you still can make. When my wife and I pray before dinner, just that the power of feeling God as we hold each other's hands in that prayer. If you have family that you are with during this isolation, do not shy away from the power of touch, because God can still work from that, and it's a luxury that you should take advantage of. And those that unfortunately don't have people with them in their quarantine and shelter place, find ways to hug yourself. Don't look down on wrapping your hands around each other when you pray instead of just looking down. Creating what touch you can to let God channel God's self through that touch is vital and an immense luxury at times like this. And so bask in it when you can.
I like that.
Well, thank you for being here. I'll just repeat, we recognize that the three of you care for your employees and your patients and their families, and that you care for the administrators and the team leaders and the doctors who take care of those people. So you are the caregivers for caregivers. And so if there is anything anyone at Royal Lane can do for you and care for you, please let us know. I know there is a whole congregation that is very proud to claim you as our own and would love to any way support you that we can. I will repeat that there is guided meditation with Mike Gregg on Fridays. It is a Zoom call. There is now, I think we have now 5 Sunday school Zoom calls happening. We're doing Sunday school with the kids. We love having you do chat on Sundays. It may not seem like a big deal, but on Sunday, it was Umberto, I think, who said that baby Noah has been helping him in the garden. And all week I've had this image of baby Noah in the garden, and it has brought me so much joy. Just that baby in the dirt just makes me feel happy. So please come to church on Sunday and offer anything you want in the chat. We will post this if you would like to watch it again on the web page. And I think I can clearly say that if you have more questions for Rhiannon or Blake or for Melissa or for Pastor Mike, if you send them to me or to Pastor Mike, we will make sure to connect you to these 3. And they, I think, will continue to be church members to all of us, even as they are professionals in the outside world doing spiritual care with others. So thank you very much. Would one of you, I'm putting you on the spot, would one of you like to close in prayer since we've talked about prayer this evening? Or I can do it.
I'll do it.
Okay, Melissa, please close us in prayer.
Loving God, we know that you are with us even when we feel alone, and we feel your presence when we are together with others. God, in these times of perhaps more aloneness than togetherness, help us remember, help us feel in our body what it is like to be in the presence of others who love and serve you. Bless this community, your blessed children at Royal Lane. Watch over us and help us be your light in our neighborhoods, in our city, and in our world. Amen.
Amen.
Amen. Well, thank you so much for coming. On behalf of the Education Committee, we also will be doing a movie viewing on Sunday, and we'll have a little more maybe silly conversation around Groundhog Day. So we invite you to that. And thank you all. I think we're going to close this meeting, but we miss you, everyone at Royal Lane, and we all send our love to you. Peace.